Bismillahirrahmanirrahim. Hello everybody. So a 36-year-old woman gravida 3 para 2 at 15 week of gestation. Come to the office for routine prenatal cure. The patient has no vaginal bleeding, leakage of fluid or cramping. She has chronic hypertension controlled by one medication. She is taking a daily prenatal vitamin and does not use tobacco, alcohol, or illicit drug. Her two prior pregnancy were uncomplicated. Blood pressure is 146 by 90 mm of Ag and pulse is 88 per minute. BMI is 28 kg. Fetal heart rate is normal. Urine lysis is negative for protein. The first trimester combined test results are reviewed with the patient and include an abnormally elevated beta HCG level as well as a 13-week ultrasound that show an increased nuchal thickness but no other abnormalities. Which of the following is the most appropriate next step in management of this patient? Amniocentesis, chronic villus sampling, dilation and suction curettage, maternal karyotype, maternal serum quadruple screen. So first of all, this patient came to us at 15 week of gestation. She is in 15 week of gestation. Second, she has elevated beta HCG level, beta HCG. And third, on ultrasound, she having nuchal thickness. So based on these four, the patient is suffering from aneuploidy and she is in 15 week of gestation. So we will go toward the choice A, amniocentesis. Why the choice A? Because this patient elevated beta HCG and increased nuchal translucency are abnormal and suggestive of aneuploidy. At 15 week of gestation, the best diagnostic test is ultrasound guided amniocentesis, which allow for aspiration and analysis of amniotic fluid. If the patient decline invasive testing, and anatomy ultrasound and cell-free fetal DNA test can be used to further analyze the risk for fetal aneuploidy. However, these tests are non-diagnostic and cannot provide a definitive genetic or chromosomal diagnosis. So the correct option is choice A, amniocentesis. Come to the incorrect one. Choice B, chorionic villus sampling. So chorionic villus sampling is performed at 10 to 13 week of gestation that determine the fetal karyotype from a placental biopsy. This patient is at 15 week of gestation. Choice C, dilation and suction curettage. So dilation and suction curettage can be used for pregnancy termination. Choice D, maternal karyotype. Aneuploidy is typically the result of spontaneous error in meiosis rather than an heritable chromosomal structure abnormality, for example, Robertsonian translocation. Therefore, perinatal karyotyping is not indicated. Choice E, maternal serum quadruple screen. So the quadruple test is performed at 15 to 22 week of gestation. It has a sensitivity and specificity comparable to the first trimester screen, and for that reason it is not indicated as a follow-up to an abnormal first trimester screen. Come to the again choice A, amniocentesis. Why the choice A is the correct one? Because first of all, this patient has an elevated beta HCG level and an ultrasound she having nuchal thickness. So the patient is fetus is suffering from aneuploidy. So in such cases, when the patient is a 15 week of gestation, we will go toward the amniocentesis, ultrasound guided amniocentesis, and I will show the picture of amniocentesis and how the amniocentesis procedure look like. So this is the amniocentesis. First, this is ultrasound guided, and here is a needle in the amniotic fluid to collect some amniotic fluid, and then we will take to the laboratory to know that which aneuploidy is the fetus suffering from. Thank you.